Thank you so much, Quality Thought and Icon, especially Krish Garu for making this possible. And guesting Mr. Harish is very difficult. He's a very busy man, and especially on a Saturday evening. Definitely it is a chat by fire. You also have an auspicious lamp here. And definitely this is a very important session because everybody is talking about technology, IT, artificial intelligence, and there is a lot of significance for healthcare. And I'm very happy to see many of my doctor colleagues here and friends. And sir, without wasting much time of yours, I just want to know, how do you think as an administrator, as a management person, technology has helped in healthcare management? We have seen a lot of evolution of technology. How did it help in management aspect?
Thank you, Dr. Mallik. We have seen a lot of industrial revolution, then Web 1, Internet 2, and the evolution is going up. Now we all are talking about the AI. And let me talk this from the healthcare perspective. We have seen the new technological evolution has brought very transformative changes in healthcare. And why I'm saying this? If you see the healthcare, there are some major issues which we need to address. One is definitely accessibility, affordability, and equitable care provided to our patients. And when we talk about technology or innovations in healthcare and how it has helped, then I will talk from the three perspectives. Definitely one is the patient care which we are talking. Second is the patient outcome. And third is how it is helping the management improve the productivity and efficiency. If we talk about the patient care, then definitely we are talking about EHR, EMR, e-prescription, because earlier all the data were in the written format in a free text. And now we all know data is a wealth, right? So if it is not in a prescribed format, it is not going to help. So we are seeing a lot of evaluation which is moving from e-prescription to EHR, and it is helping to understand, analyze patient continuity of care and definitely the outcome. Second, if we move from the initial access provided to patient, then we'll go to diagnostic. In diagnostic, we are seeing a lot of digital health, digital pathology. We are seeing a lot of new innovation in terms genome sequencing, molecular diagnostic, which is helping patient to provide a very precision care. So that's where it is helping in the diagnostic. If we talk about the patient outcome, then through the continuous care provided to patients and keeping the track of all the data, we track the clinical outcome, and based on that we take a further decision to improve the patient outcome. Then let me say how it is helping the administration. There are a lot of processes in hospital which is happening in the written format. And I'll go back to my third organization, healthcare. I was working for Max Healthcare in Delhi, and we converted the entire hospital digitally. So there was not a single paper which was available. And by doing this, it brings a lot of efficiency. Then repetitive work which is required, we can remove through the automation process. And on one side, hospital and many others spend a lot of money in getting the patient in the hospital, but sometimes they leave if you don't keep a track of it. So with a lot of initiative, you can keep a track of the patients and then ensure that you provide a care to patients. So it helps in reducing the wastages. I will not say cost efficiency, but you can reduce a lot of wastages with the help of the technology. So that's how all the technology and innovations helping in healthcare. So now, since you have asked me this from the management perspective, I would like to ask you as a clinician how you see this.
Yes, absolutely. So when we go back, actually I can tell technology has been a groundbreak in healthcare. When we go back to 80s, mid-80s, late 80s, we were totally dependent upon our clinical judgment, on our clinical findings. So we have our colleagues said definitely they agree with me, and towards late 80s, we hardly had only X-rays. For any diagnosis starting from stomach pain to headache, we had only one X-rays and few medical lab reports. But when it came to early 90s, maybe ultrasound was coming, it was new. And towards the end of 90s, I have seen suddenly emergence of so many diagnostic centers, CT scans, MRIs. So I can tell it has totally reshaped, remodeled the way we look at the patient, the way we diagnose, the way we treat, the way we monitor the patient. I think we are able to give a more personalized care and making the experience more beautiful. So apart from that, one more thing I can tell is, it is reducing the human errors, basic human errors done either from the nursing side, doctors, or even from the patient themselves. So apart from that, nowadays you must be hearing about virtual assistants, where the technology is helping, reminding patients to take medicines on time, diet, helping them with their diet, helping them with appointments of doctor. And just as you are talking nowadays, even taking appointment has become very easy. People are able to take online appointments, and they're getting reports immediately. Previously, we had to wait for 2 days, 3 days for the reports, but within 1 hour, 2 hours, immediately we're getting it to the mail. And again, we can send that report to doctor immediately. And beyond all this, telemedicine has emerged in a big way, thanks to COVID. Even now, there are many people, being an oncologist, I can tell that many people are coming from remote places of Telangana, Andhra. Before coming to me, they really want to have a consultation. They're sending the reports across to us, they're taking consultations, even monitoring also once the treatment is over. They can't afford so much expense for traveling. Even for monitoring also, telemedicine has helped a lot. I think overall technology has made the experience more pleasant for the patient. And sir, then nowadays you are seeing, we are hearing so much about technology like cloud, automation, blockchain technology, interoperability, so many, etc., etc., etc. Because as and when your MBA people are coming, management guys are coming, all these new technologies are coming, blue ocean and whatnot. So American Oncology Center, coming back to you, you have multiple centers. You are in acquiring spree or having so many centers. How are you able to coordinate different centers, your data, experience with different centers? How are you able to coordinate everything together for an effective operations or effective patient care?
Thank you, Dr. Mallik. We have got 16 centers and another 9 in pipeline. So we have got our presence from Jammu to the south in Coimbatore and west from Nagpur to east in Imphal. So across length and breadth we are present. And when we are growing organization very fast, we need to use technology to provide a standard of care all across. Especially we deal with the cancer, and which is a very complex disease, we all know. So what we do first, we have all the integration of the data through HIS and I said e-prescription. We collate all the data, so on the regular basis we know what is happening, what kind of a patient coming, and we have also a centralized cancer registry within the organization. So we know from which city, male, female, what kind of cancer and how it is progressing, what is the diagnosis, what is the survival rate after 5 years and 10 years, we keep a track. Apart from this, we have a software which is created. We are a Siemens company. We are 100% subsidiary of a Siemens Healthinia. So we have created a software which is called ARIA, where we do entire treatment planning and monitoring of a patient outcome in a system. So it's a centralized system which is available to us. And I'm sure you and everybody understand, in India, the availability of the doctors, that to a specialized oncologist, if we talk about, most of the oncologists you will find in the metro city or A-class city, but when you go to tier 3, tier 4, it's really difficult. So it's completely imbalanced. Where you have more than 65% of the patient coming from rural area or tier 3 and 4, 65 to 70% of the doctors available in metro city or A-class city. So this is completely imbalanced, and accessibility and availability of the good clinician is a problem. So what we have done, we have created a centralized planning system. So all our radiation or medical oncology protocol is given from the center, and it is provided at all the centers. So even if sometimes clinician is not available or medical physicist not available, we do it centrally and provide to centers, so it becomes very easy. Then we also conduct a tumor board. And since we are, so our company was acquired by the Varian, which is a US multinational, and that is acquired by the Siemens, so it's German company. So we have got access. So we are the highly integrated largest oncology player because we also manufacture the equipment. So we have got access to the clinician which are based out of the US and Europe, and we conduct a international tumor board which is multidisciplinary. So the perspective and on the kind of advice which is available with us for the patient, which will not find anywhere. So we conduct an international tumor board. Then we do a lot of genome sequences. I have talked about molecular test which we do, and that really helps patient because we are also in laboratory. So if you don't know, then our brand is the Empath Lab. So we do very high end of B2B work. So with this, we provide a very precision care, and that we provide a immunotherapy kind of a thing. So it really helping all this technology which is available, or latest one. We have also recently installed the Ethos, which is a very adaptive radiation treatment therapy which is available to patients when they are in the say on a couch and there is organ which are moving, so it is automatically adapting to new planning and provide the very precision care to patients. So this all this technology is helping patients and better outcomes are. So now I would like to ask you, since we talk about the technology and you talked earlier about the role of AI, so what is the role of AI and how it is helping the patients?
Definitely, not only in specific for oncology, actually AI has come a very big way in healthcare. So as you mentioned, now we have a lot of clinical data. He's talking about 17 centers. So we have a lot of clinical data in the form of EMR. So we have now machine learning algorithms through which we are able to analyze the data, study the patterns, and predict the outcomes of different treatments and different health conditions. So apart from this, it's also helpful in preventive healthcare. Now by studying the subtle changes, by calculating the subtle changes happening both in the clinical level, even diagnostics level, or a lot of, as you're talking about, lot of biomedical changes, by just observing the subtle changes, small changes, we are able to predict what health risk an individual is going to face. Not only cancer, but different health risks. So we can always use it as preventive healthcare. And also we can, nowadays starting from the big scans and images, nowadays we are having wearable devices. It has come very big way, starting from continuous glucose monitors, heart monitors, which are going to alert the patient about the dosage they are going to take and also alert the clinician. I think primarily this is the thing where we are going to heading in healthcare technology. So, personally, what patient improvement have you seen because of the artificial intelligence? What patient improvement have you seen?
Right. So, if you see the current care delivery which we provide to patients is a curative. When any patient is not well, he will go to hospital. As a management and you clinician treat the patient and send them home. During the COVID, we realized the vulnerability of the healthcare system, and we know not much of our beds are available in the system. So what we do, as you rightly said, there are a lot of wearable devices available to the patients, and the approach has to change. You mentioned about the preventive healthcare. So patient needs to, instead of going to hospital, they need to take care or ownership of their health, measure all the parameter with the whatever the devices available, IoT devices or wearable devices of their health. And if unless and until they need any curative approach, they should go to hospital. And we all know beds are very important in hospital. So you can send the patient back with the home health care where all the patient key and critical parameter can be measured at home, remote monitoring of the patients, and all this will really help in the patient outcome.
So I think we are running out of time. I want to end this with a last question. Mr. Harish is the man of numbers. He's with financial background and he heads the center. How do you think health technology in healthcare has benefited financially?
So, with all the use of technology, I said a lot of wastages can be reduced. Where we put a lot of manpower in tracking a lot of different parameters which you can automate and then definitely reduce the manpower and work more efficiently. We use social media, digital strategy to reach out to patients. And with the help of technology, we ensure we follow up with the patients and ensure they are on a regular basis following it up back with the patients. So a lot of wastages or the extra amount which is spent even on reaching out to patients, it is all reduced and it is very precision. It goes where it is required. So it is helping the management in reduce the cost.
Thank you, sir.
Thank you. Thank you, everyone.